Hello, and thank you for joining Cholangio-Hepatocellular Carcinoma Canada for this webinar on nutrition and cancer. Jessica Andersen is a talented and knowledgeable registered dietitian who will be presenting our webinar on nutrition and cancer. I know firsthand how knowledgeable she is, as I had the pleasure of working with her for 5 years at the Red Deer Regional Hospital Centre. Jessica is a registered dietitian and has extensive knowledge and expertise in the area of dietetics. If you have any questions, please place them in the chat and we will ask them after the talk is finished. Welcome, Jessica.
So hi, everyone. Yes, I'm Jessica. Brenda had asked me to put together this presentation for you guys on nutrition and cancer. So there's going to be some general information. There's going to be some that's a little more specific to cholangio-hepatocellular carcinoma, So let's just dive right into what we're going to be talking about today. Just so you know, if you're asking questions later, you can pop questions and those types of things into the chat as they kind of come to you, or write them down, but there will be a chance to ask questions at the end. And even if you have questions later, feel free to send things to Brenda. I'm happy to talk to people over email or whatever afterwards as well. That's totally fine, because sometimes you don't know what questions you have until later. I get it. So let's start with a brief overview. We'll discuss what nutrition can do for you and what it can't do for you, trying to set up some realistic expectations. We'll talk about managing nutrition impacting side effects that can stem from treatment or the cancer itself. We'll touch on foods to avoid, if any, as well as how your cancer may be impacting your nutritional status. We'll touch on what to do/expect if you do end up becoming admitted to hospital, and where to go to ask for assistance with your nutrition. I strongly encourage everyone here to seek out nutrition advice that is customized to your situation and to be your own advocate to get a dietitian involved in your specific care. Okay? So this is just a stock photo, some healthy foods that we're going to be talking about. Okay? So let's start off with a brief introduction of who I am and how I ended up being here talking with you guys today. So I'm Jessica Andersen. I've been a practicing dietitian for about 8 years now. I got my undergrad from the University of Alberta, and I completed my dietetic internship in Calgary, Alberta. For those who don't know, the dietetic internship is a requirement in Canada to become a registered dietitian, and it's a full 11 months of full-time work with different dietitians in different practice areas that help us train for real-world applications and working as dietitians. So in addition to a 4-year degree which specializes in human nutrition, a dietitian also has a full year of practical training as well. So I was extremely lucky to have my internship in Calgary. I had excellent preceptors throughout that experience. I spent the majority of my clinical rotations working at Foothills Medical Center, where I did a rotation with Rebecca Holmes, who was an incredible dietitian that I think most of you probably have heard of. After I finished internship, I did start working as a casual at Foothills as well. So I got the opportunity to also be trained and mentored further by Rebecca. And I learned so much from her every single day that I worked with her. She was an absolute wealth of knowledge. As you guys know, Rebecca passed from cholangiocarcinoma a few years ago. Before Rebecca got sick, I moved to Red Deer and I took a position at the Red Deer Regional Hospital, which is where I met Brenda, which you guys know is Rebecca's mom. So as you know, I got to work with both of them, which was lovely. As a family, they are so caring and loving, and they prized evidence-based research and helping other people over all else. So I was very honored when Brenda asked me if I would be willing to put on a presentation for you all as a former student of Rebecca about this particular topic. So let's talk about what nutrition can reasonably do for you. So when starting out after your diagnosis, it can be hard to think about what sort of things to focus on. Nutrition should always be one of your priorities. Nutrition should truly be a priority in everyone's life, whether you're fighting cancer or not, but that's a topic for another time. The reasons for this are many why nutrition should be a priority, but perhaps one of the most important ones is that proper nutrition can improve your quality of life. Before, during, and after treatment, if your nutritional status can be maintained, you'll move through these transitions a lot better. You can have more energy and maintain your muscle mass. If your muscle mass can be maintained, not only will you be more functional, which will allow you to do more things for yourself, but if your muscle can be maintained, you're less likely to have adverse effects to your treatment, including surgery and chemotherapy. If your nutrition status is poor, you run the risk of things like nutrition deficiencies. If you develop nutrition deficiencies of any micronutrients, such as vitamins and minerals, or macronutrients, including carbohydrate, protein, or fat, you'll have a harder time healing or getting better until these are addressed. Proper nutrition can help manage other chronic diseases such as diabetes or something like celiac disease, which, if not properly handled, will make treatment way more difficult. If nutrition can always be a priority, this will help make malnutrition a less likely outcome prior, during, or after your treatment. That being said, nutrition, of course, has its limitations, just like anything else. So let's talk about what nutrition can't do for you. Nutrition, no matter what someone tells you online, does not replace medicine. If it did, we wouldn't need medicine, and we most certainly do. For example, nutrition cannot control your pain. Nutrition cannot bring down your blood pressure if it's very high and you're in crisis. Nutrition also can't replace things like antibiotics. Medications are important and necessary. Nutrition also cannot change your genes. No matter how much we try, we can't change our genes. Some types of cancer, just like other types of illnesses, have a strong genetic component. Now, this doesn't mean that diet and lifestyle aren't helpful or that they don't count for anything. Of course they do. They can help delay the onset of some diseases, or they can make them less severe. But if you do end up with any disease, regardless of having a healthy lifestyle, it's not your fault. And I want everyone to remember that piece, because sometimes people get concerned about that if they did something. You absolutely did not. You cannot healthy lifestyle your way out of your genes, and developing an illness is never someone's fault. Nutrition also cannot cure cancer. I'm sure you've seen some kind of fad diet or another that's claiming that it can cure or shrink or stop cancer from spreading. This isn't true, and I highly encourage you not to listen to people touting extremely restrictive diets. If it sounds super complicated and too good to be true, it probably is. So let's talk about some common forms of cancer treatments. So there's 4 fairly common types that you see across the board: chemotherapy, radiation, immunotherapy, and surgery. Some people only have 1 or 2 types, or sometimes you have several different that are coming together for your treatment plan if you are pursuing treatment. All of these carry the possibility of side effects that could make proper nutrition difficult. There's also some newer targeted therapies that are emerging. At this time, I'm not aware of a lot of the nutrition-related side effects of these because, again, they're still fairly new. But given time, maybe this is something we can talk about in another presentation on another date. So let's touch on some common nutrition-related side effects. So there's many different possible nutrition-related side effects of treatment or of the cancer itself. This is not an exhaustive list of side effects of the cancer treatment. However, it does hit a lot of the most common ones that can negatively impact your oral intake. The side effects include nausea and vomiting, diarrhea and dehydration, poor appetite, sometimes referred to as anorexia, rapid weight loss, and we'll briefly touch on a term that you may hear, which is cancer cachexia. Other possible concerns are things like taste and smell changes, dry mouth, mouth sores, or fatigue. So nausea is perhaps one of the most common nutrition-related side effects that I see in hospital across all patient populations, not just cancer. Nausea can be brought on by any number of things, but medications or treatments themselves are a fairly likely cause most of the time. Anti-nausea meds, also known as antiemetics, are a powerful tool you can use to help yourself feel well enough to eat. If these are working for you, consider talking to your doctor about the feasibility of taking one prior to every meal. If your symptoms are still not fully controlled, consider eating more carb-heavy items, thinking things like bread or crackers when your nausea is at its worst. These things are often better tolerated. Ginger has also been known to help with nausea, whether you use ginger root, ginger ale, pickled or candied ginger. This can just help settle your stomach and might help you feel ready to eat in a shorter period of time. Consider also eating cold foods. These give off less scent and are just less stimulating, and sometimes this is better tolerated. So if you're not feeling particularly well, consider trying something like a sandwich or a cold plate if you're finding that a hot food item is not working very well for you at that time. Diarrhea and dehydration is another thing that we're going to be talking about. So diarrhea itself could lead to dehydration. If someone is finding that they are quite dehydrated, this could lead to additional complications such as kidney injuries. So again, that itself could bring you into hospital perhaps. Diarrhea can be caused by some medications such as antibiotics, or treatments like both chemotherapy or radiation could bring on something like diarrhea. When I'm saying diarrhea, I am talking about a bowel movement that's mostly liquid and multiples a day. What we consider diarrhea in healthcare is a little bit different than what some people consider diarrhea in community. So I'm just clarifying that piece there. A loose stool is generally not a super large concern and is much less likely to dehydrate you than a liquid stool. If you're experiencing diarrhea, it is important to replace your fluids orally. A general rule of thumb is to try and replace each stool with at least a full cup of water. If you're having many a day, even consider having a sports drink to help replace lost electrolytes like sodium. If symptoms persist for more than a day or two without improvement, do contact your doctor if you're having multiple watery stools a day. If ongoing for about 3 days, and especially if you've recently been on antibiotics, you may need a stool sample to rule out a GI infection such as Clostridium difficile. I'm sure you guys have all heard of C. diff before. That would need to be treated. Especially once an infection has been ruled out, you can consider medications for helping slow the bowels down, like loperamide, which is also known as Imodium. Soluble fibers can also help with slowing down movements through the GI tract and forming stool. So bananas, oatmeal, citrus fruit, and things like Metamucil or psyllium husk will all help with that. Poor appetite is a very common side effect of many types of illnesses. Unfortunately, there truly is no magic bullet for poor appetite medication-wise. There are all kinds of factors that can impact your appetite. So treatments, your cancer, and your mood are some very common ones that can impact how you're feeling and how you're going to go about with your appetite. If other symptoms are contributing to poor appetite, such as nausea or pain, so some of those physical things, try to manage these first and see if that helps. Speak to your support system and your doctor if your mood is low or your emotions feel like they're contributing to your poor appetite. Consider eating smaller and more frequent meals. This can help get more in a day rather than sticking to the more standard 3 meals a day. When your appetite is poor, focus on protein and calorie-dense food when you are feeling up to eating. Consider supplementing your solid food intake with nutritional supplements such as Ensure or Boost or other brands. The brand doesn't really matter. It's more about having one of those calorie-dense fluids, just because it is easier to drink your calories than eat them when your appetite is low. So rapid weight loss, some people find their weight is very difficult to maintain no matter how hard they try. They find that they're eating the same amount of calories as before, but their weight continues to drop. If you're battling any other side effects, this rapid weight loss may become more pronounced more quickly. It is important to be on top of your weight in order to be proactive. So monitoring your weight trends and keeping track of that is very consistent, or is very important. If it's consistently declining, you should be taking action on that. Your needs for calories and protein may be higher than usual. When your body is fighting to get better and healing, calorie and protein needs may be higher than they used to be. Increase what you eat in a day and prioritize calorie-dense and protein items. Again, consider supplementation, Ensure, Boost, whatever works for you to help you meet those needs, rather than it can be difficult to try and eat large volumes of food. If you're struggling with the ambiguity of me just saying get more without giving you any specifics, you could talk to your dietitian and ask for something to help you get a more tangible number when we say get more. So one thing you could ask for is something called indirect calorimetry. So indirect calorimetry indirectly measures metabolic rate by measuring oxygen in and CO2 out when you're breathing at rest. This will give an indirect estimation of your metabolic rate. However, keep this piece in mind that this is linked to your muscle mass. So if you've already lost a lot of weight or a lot of muscle at this point, it may give you a number that is lower than is likely helpful to you. Okay? So, and if you are looking to get indirect calorimetry done, your dietitian can probably find a place to suggest this for you. However, a lot of these places are often places like physiotherapy clinics and the like. Some hospitals do have them, but some places you might be required to pay for it. So you just got to keep that piece in mind. Cancer cachexia is a special term to refer to rapid, unintentional weight loss that can occur in cancer that is not just simple weight loss, but it is driven by inflammation and metabolic alteration. Truly, there is at this time a lot that is still unknown about cachexia, but it's not just regular weight loss. It can preferentially increase loss of muscle over other types of tissue. Loss of muscle can lead to limitations in treatment, as muscle is generally what is helpful with metabolism of drugs. Loss of too much muscle can lead to bad drug reactions that could lead to pauses in your treatment, potentially. Cachexia can lead to anorexia, fatigue, and fat and muscle wasting. Nutrition support, such as tube feeding, can help manage cachexia, but this requires a lot more research, as cachexia is more than just poor oral intake or calorie deficit. Increasing calories does not always lead to increasing weight in someone who has cachexia, but it does usually help stabilize weight, and that's step one. So it's helping already. There are some other symptoms that can negatively impact oral intake, so we'll run through a few quickly here. Taste and smell changes can impact about 50% of people, especially if they're undergoing radiation therapy. Zinc supplementation has had varying success with improving symptoms. Most successful if your zinc is actually low, so having your levels checked and potentially repleted is kind of a really good starting point. Seasoning foods with preferred or strong seasoning can help bring flavors forward, or salting or sugaring food can also help offset if you're having those kind of wrong taste and smell issues. Sorry, we're also looking to keep your mouth moist, and good mouth care is important as well for many things. It is overall agreed upon that it will minimize risk of infections and other complications by doing consistent mouth care. Dry mouth is very prevalent as well. Consider something like a saliva spray for this, and when you're eating, alternate sips and bites to help keep your mouth moist. If you get a thick white coating on your tongue or in your mouth, this could be thrush, so show your doctor and they will have appropriate treatment options for you. As for fatigue, conserve your energy using pre-made or low-prep food items, and consider using nutrition supplements, again, to help increase calories and protein without greatly increasing your energy expenditure to make these items. And ask for help for those around you for meal prep and other help that you might need around the house. There's nothing wrong with getting help, and it's very important that you ask for it if you need it. Moving on to what I'm sure a lot of people have on their mind: what foods should I avoid? Generally, we want to be as least restrictive as possible. So in short, almost nothing needs to be restricted. There's almost nothing that we recommend across the board you should not eat while undergoing treatment or going through your cancer journey. The small exception would be alcohol, as it often does not play well with a lot of your medications, and possibly processed meats, because these are high in saturated fat and sodium, and it's sometimes not super well tolerated due to this. As well, alcohol and processed meats are in fact the only two foods with a true link to GI-related cancers. So these would again be another reason that these are good things to be avoiding. Now, some individual restrictions may apply based on treatment if you are pursuing this. Your doctor or pharmacist may recommend a restriction. For example, some chemotherapies require a limitation of citrus. Otherwise, you are free to eat what you like and encouraged to eat a variety of foods and ensure intake of adequate calories, vitamins, and minerals. As well, enjoyment is very important for your mood and overall well-being. I did add in here, just to be a little more specific, what about sugar? Can I eat sugar? Do I have to stop all carbohydrates? Doesn't sugar feed cancer? The answer to that is no. Obviously, I don't want you to be living off sugary foods, but don't cut them out entirely either or deprive yourself, especially if there are milestones or special occasions. If there's a reason to celebrate, do this. This is good for your mental health and some semblance of normalcy. It's very important to be enjoying the social aspect of food with your family as well. If you're undergoing treatment or not, sugar is still something that you can eat and will no way derail your journey. There's no evidence that eating carbohydrates or sugar will make your cancer grow faster. Generally, we want to restrict as few foods as possible. The best way to keep yourself strong is to eat a varied diet, and that can include sugar. The same idea of not being restrictive goes for other fad cancer diets as well. So things like alkaline diet, intermittent fasting. There's not enough evidence to recommend any of these, and they run a high risk of being too restrictive and putting you at risk of muscle and weight loss, which can negatively impact your quality of life as well as your treatment options. So as of now, be as least restrictive as possible and enjoy your food. Let's move on to how is my cancer impacting my nutrition? Because of the location of your cancer, your nutrition may be impacted as your absorption may be a concern due to obstruction of bile ducts or damage to your liver. Or if this isn't the case currently, it could be in the future post-treatment or surgery. The thing most likely to be difficult for you to absorb at this point would be fat in your diet, although protein can also be impacted to an extent. If you are malabsorbing, you may experience abdominal pain, bloating, excessive gas, diarrhea, or fatty stools that are pale in color. This is also known as steatorrhea if you hear your doctor using that term. These stools can be frothy, loose, difficult to flush away, and all of these things, if you're malabsorbing fat, could eventually lead to weight loss. Fat is very calorie dense. Not absorbing fat from your oral diet will decrease the number of calories you take in quite considerably and start to impact your weight in what could be a very short period of time. Protein and carb have other ways to absorb. Fat really doesn't. So that's why it can really impact how well you're able to get the calories out of your diet. If you're struggling to absorb your fat, pancreatic enzymes taking orally may help you absorb better. If this is the case, finding the right dose and adjusting your dose might take some time. As well, these enzymes would then need to be taken with all meals and snacks moving forward to get the appropriate nutrition from your food and minimize your symptoms. Okay? So continuing on with how my cancer might be impacting my nutrition, a damaged liver doesn't function quite the same as a healthy one. As such, your liver might not be storing energy like it used to. Rather than picking away at your reserves, and when I say your reserves, I'm talking about things like your muscle and your fat, we would rather that you eat more frequently so that your body is not trying to break down itself for energy. Okay? So instead of letting your body reach a fasted state, eating more often to avoid breaking down your muscle is recommended. Generally, eating every 2 to 3 hours. So for example, if you're leaving the house, bring a snack with you, eating a snack before bed, having a snack available to you next to you as you sleep. Not saying you have to set an alarm and wake up for it, but if you do end up waking up in the night, having something to eat could be helpful to you. As discussed previously, fat especially may be hard to absorb. With that in mind, some fat-soluble vitamins, so A, D, E, and K vitamins, as well as potentially vitamin B12, might be difficult to maintain, as well as some minerals, so zinc, selenium, and copper. These might be hard keeping them at appropriate levels. You could consider supplementation of these or just a multivitamin. And if you're unsure if yours are low, you can always ask to have your levels checked. Some other potential things that you could run into, especially post-surgery, could also be bile acid malabsorption, also known as BAM, or small intestine bacterial overgrowth, also known as SIBO. Both of these are often missed or misunderstood specifically by the surgical team. They might say that you might just be having some post-surgical concerns, or they might say something like IBS may be going on. They might not be familiar with these as the surgeons. So you could request a GI specialist to consult to dive a little deeper into your concerns with this. So, how should I eat if I'm feeling well? Thus far, we've talked a little bit about what to do if you're having some issues, but if you're feeling well, what would we generally be recommending? We would generally recommend just a regular, healthy diet. Fruits and veggies are nutrient dense and have antioxidants and polyphenols, which provide good nutrition to your body and help support your cells before, during, and after treatment. As well, they're fiber rich. Fiber is excellent to keep your digestive tract as healthy as possible. The average North American diet is also way too focused on meat, especially red meat. So we would recommend trying some non-meat protein sources, so beans, peas, tofu, lentils in your diet, and aiming for 25% of your plate to be protein. Focus on fish and poultry instead of red meats. And fish contains omega-3 fats, which are great to work into your diet 2 to 3 times a week if you can. This can help decrease your risk of things like heart attack and stroke. Unfortunately, those who have cancer are at an increased risk of heart attack and stroke. So if you're not someone who currently eats fish or other sources of omega-3 in your diet, now is a really good time to start. We would also recommend 25% of your diet should be whole grains. The whole grain version of your grain products contains more fiber and more B vitamins. As stated before, fiber is great for your GI tract, and the average person gets way less fiber than is recommended. This is the new Canada's Food Guide. You may or may not have seen this before. It's also modeled after something dietitians have been using for years, also called the Healthy Plate Model. As you can see, half the plate is full of fruits and veggies, providing lots of vitamins, minerals, fiber, and antioxidants, all great things. A quarter of the plate is those protein sources, and you can see there are meat alternatives such as nuts and legumes noted there. As well, this is generally where you would see your dairy products fitting in, because we're not saying dairy products are bad, they just got put in a different area. There is a low representation on this plate as well of red meat, because we're again trying to lean towards different types of meat, so leaner cuts of meat as well as fish. The last portion is a quarter of the plate that has whole wheat or brown versions of your grain products. Again, we're getting more B vitamins and fiber if we're eating the whole wheat or the brown version. I wanted to touch very briefly on mood and nutrition because I think it's very important to discuss mental health as it can greatly impact how you're able to function. So, as outlined, eating well and enough during this journey can be hard. Sometimes mood is a reason for poor appetite or decreased oral intake. If your intake is poor and you're not eating well, even though physically you have no barriers, reflect on things like your mood and how you're feeling. Is this something that needs to be worked on to help you eat more? Talk to your healthcare team with any of your concerns. The mental load of getting a diagnosis, preparing for and undergoing treatment, as well as recovering can be a lot. If you find you have a low mood or your mood is impacting your ability to do things that you usually enjoy, talk to your healthcare team. There are resources and support available, as well as medications that can help improve how you feel if necessary. So, what to do if I get admitted to hospital? There's a good chance at some point you will be admitted to hospital throughout this journey. Even if you feel it's not necessary, I highly encourage a dietitian consult. Even if you haven't lost weight, even if you're eating well right now, your nutrition risk is very high. Early interventions from a dietitian can be very helpful to you to make sure that you have someone who's following along and able to help immediately if required. They can also help you get hooked up with someone post-discharge to continue to follow up with you once you leave. Whether you're admitted for symptom management, for active treatment, or due to side effects of treatment, having a dietitian as part of your team to address nutrition concerns early can decrease the length of your stay and improve your outcomes. A dietitian can continue to assess you during your stay and recommend changing the way you receive your nutrition if needed, including recommending tube feeding or IV nutrition if necessary. This is extremely important if your treatment plan includes surgery to make sure you're going to heal properly. So, who do I talk to outside of hospital? If you're looking to get started right away and you're not admitted to hospital, your cancer clinic will have a dietitian you can access to work with you during your treatment and the lead up. If you're not pursuing treatment or treatment hasn't started or your treatment has completed and you still feel you could use assistance with your nutrition, home care also has dietitians that you can connect with, or else the primary care network or your hospital should have a general outpatient who can also address the majority of your concerns or knows who to talk to in order to get those answers. So some general takeaway messages. Nutrition is very important prior to treatment, during treatment, and for proper healing after treatment. It's also important for quality of life if you're not going to pursue treatment. Throughout your journey, there's likely to be times you will have a hard time getting adequate nutrition, whether due to your cancer or your treatment or how you're feeling about the situation. Whatever your concern is, ask for help from your healthcare team and your loved ones. It's very important to ask for help when needed. If you have symptoms, whether that's nausea or diarrhea, whatever it may be, actively pursue improvement of these. There are approved treatments, and do ask to pursue management of any and all types of symptoms. Don't just suffer. Don't allow people like your healthcare team or others to say this is as good as it gets. Ask what else can be done. There's always more that can be done. A healthy diet is made up of variety, so eat many different foods, switch things up. This will ensure that you will get enjoyment out of your food, as well as ensure you're getting adequate vitamins and minerals. So that's all I have prepared this way. I did put this in maybe not the best order. I do actually also have some recommended resources for patients, so that is in there as well. There is the nutrition guide for people with cholangio and hepatocellular carcinoma that's actually found on the website. And I also added the high protein cookbook for muscle health during cancer treatment that was actually put together by one of my old professors. So it has a lot of great recipes that are all high calorie, high protein. I highly recommend it if you're looking for just more recipes and other things that you can use and rely on. So now we'll go back to the questions.
Thank you, Jess. We will now go to the chat box for any questions that people may have. The bloating, the abdominal pain, the excessive gas, that's due to malabsorption. That's correct?
Yeah, we would usually chalk that up to malabsorption, at least as kind of like the first thing that we would look at. If you're not sure, asking your doctor about things like pancreatic enzymes is a very low risk intervention. At best, it's helpful to you. At worst, it doesn't really impact you. So it would be something that you can definitely request and do to see if that improves your symptoms and would help with your absorption.
Are organic fruits and veggies better?
As a dietitian, that's a question that I get a lot. No. You do not have to shell out additional for organic. You absolutely can have the regular stuff. As always, organic or not, we do recommend that you're washing your fruits and veggies before you're eating them. Again, that's just because they're going to have dirt and stuff on them. They may also have some spray, but no, organic is not better for like the vitamins, the minerals. It's not superior. It's more expensive. And I don't think anyone needs to pay that additional cost for it's the same product. Just make sure you're getting your fruits and veggies. I don't care if they're organic or not.
Is it important to wash the fruit and veggies before you eat them?
Yeah. So especially if you are going through active treatment, your immune system is not going to be as good as normal. So it is really important to make sure that you are thoroughly washing fruits and veggies before you're going to be using them. Cooking your meats to an appropriate temperature is also going to be really important for you, making sure everything is really well cooked. I usually recommend using soap and water is really helpful if you have time for it, or some people, if you're going to do all of them all at once. I do know some people who do like a bit of a vinegar wash and just kind of stick all their veggies in the sink. That's totally appropriate as well. Whatever works for you and you have time for.
Is it okay to eat raw veggies or should they all be cooked?
It is okay to eat raw veggies. If you are finding that high fiber foods are causing you some GI discomfort, cooking them, you'll tolerate them potentially a little bit better. So that's just another thing you could do if you're having bloating, cramping, diarrhea. If you're feeling well, you can absolutely eat raw veggies. Just again, make sure you're washing them well, or if you're buying them, they say thoroughly washed, that kind of thing.
Are there any herbs or spices to avoid?
Generally, no. If you're having diarrhea, it's maybe not the best time to be breaking out the hot sauce because that could lead to some additional inflammation. And there's nothing specifically I would say across the board needs to be avoided. But if you have something that has bothered you in the past, it's probably going to bother you now. Quiet. And again, some of those things that are a little more likely to cause irritation, so spicy foods, it might be a good idea to skip those for now.
What website is Book on Nutrition from?
The first one is from Nourish. They're the ones who put it together, and they put it together specifically actually for the hepatocellular carcinoma website. So that piece you'd be able to find just on the website. And then the other one was I had a few of my colleagues work on reviewing this with me, and she said, hey, our one professor had put this one together, so she sent me the link to that one. You can download it, yes. And a lot of cancer dietitians as well also have like hard copies for you. So you could ask your clinic dietitian, because they made it at the U of A, and then they sent copies all across the province. So some have boxes of them. You can ask, do you have a hard copy of this one? Yeah, it has a lot of other good ideas in there, just more recipe ideas. Again, especially if you're not feeling super well, you're not eating as much as usual, really making sure you're getting the good calorie and protein options in there for you is important. And just for some ideas, right? It's good to have a little bit of the idea piece taken off your plate.
I would like to thank everybody for their time today, both Jessica for presenting and everybody who listened to the webinar. If there are any further questions, please contact us at mychcc.ca, and we will get back to you as soon as we can with the answer. Again, thank you for your time.
Thank you for asking me. And again, if you have things, do send them to Brenda. And we were wondering about making this even something that we do on a regular basis. So if you have specific topics you want talked about, get in touch with Brenda. We'd love to talk more. Thank you. Sorry about the dog going off.
Jessica, thank you very much for sharing your time and your expertise with us. Thank you.